Welcome to The Big Picture. I'm Phil Arno. Most of us have seen the daily press conferences that are held by the president and the governor and the Erie County executive. Now, these guys are all government officials, dare I say, politicians. They're good at telling a story, very good. They can give us numbers, they can give us rules and regulations and justifications and logic until we're blue in the face, or we change the channel, which a lot of us have done. But behind each of these illustrious leaders stands another, quieter person in the background, ready to step forward and answer the important questions, the ones that have to do with the medical side of the situation. Because in the end, or should I say in the beginning and the end, all it starts with is the doctors, for they are the ones that we look to for understanding. And now, for a little of our own understanding, I'd like to welcome to The Big Picture Dr. Gale Burstein. Gale, it's a pleasure to have you here, and I want to start out by asking you, as of 2 months ago, how has your life changed over the course of this coronavirus lockdown?
Well, as health commissioner, on a regular day, I deal with many different public health problems. You know that in especially last year and the years before that, we've really been focusing on our opioid overdose epidemic. We also have big problems with high rates of sexually transmitted infections and HIV. We're also seeing problems with especially adolescent depression and suicide, and problems with immunizations. We're dealing with restaurant inspections. You name it, we're dealing with it. But now it's COVID. So really, most of my day is really focused on how do we tackle this bear of COVID-19. And the response is really huge. And it's not just working within the health department, but it also means forging strong communication and collaborative efforts with other departments in the county and also with community partners. So, this has been a huge endeavor. And, still, we have to consider, how we can keep, our county operations, our health department operations going at a minimal level, like really meeting the needs of essential services that we need to provide to the community. For example, restaurant inspections, and also, unfortunately, there's still suicides and homicides. So our medical examiner's office is very busy. And then thinking about, how to rearrange things, how to deploy some people that are working in jobs where, maybe, they don't have to work, they don't have to spend the time, say, working in the clinic because our clinics aren't open. We made sure that all our clinical services are being either we're covering them or they're covered by community providers, but our clinic operations aren't as busy. So say for, people working at 608 William Street in our clinic and our STD program, our family planning program, our TB program. So not all those folks are working. So deploying them and helping them get trained and work on contact tracing. So it's been, figuring out how to be flexible, figuring out where to plug the holes, how to communicate and talk with other departments at the county, how to work with partners. So it's been quite a challenge.
Yeah, I can imagine. We all see the briefings, and I know this is a governmental thing where we have regulations and rules and things that the people have to be controlled to an extent because of the nature of everything. But it's also a medical thing. It stems from the medical situation to begin with, and that's where you come in. How much of a role do you play at the beginning, from the medical point, in advising the government side as to how to conduct things?
Well, again, much of what we do in the county is directed from the state. So the state really, provides us with, policies and protocols and procedures. And so we have to figure out, how the devil's in the details, right? So we have to figure out how we implement that here. And it's really important having a good fund of medical knowledge to make sure that what we do makes sense. So, I'm really trying hard to keep up to date with reading the medical journals and staying up to date on that, and making sure that what we're doing, makes sense, and that it's really meeting the needs of the county. So again, with in New York State, the way public health works, for many different types of operations, is that we receive directive for the state, especially with this COVID-19. We're receiving many directives from the state, and then we figure out how to implement that here in our own local community.
Okay. I've heard a lot of, you say you keep up with the journals, and I've heard a lot of different reports about some of the medicines and vaccines and so on, some of the studies. Chloralquine, for instance, is a medicine that's been used for many, many years to treat malaria. And I've heard different stories about tests and results in France and in New York City, where there's been very positive stories. Haven't heard much in the way of negatives on it, other than if you have a heart problem, you should be under doctor's care, and the dosage must be regulated a little bit more carefully. But I'm not really seeing a lot of results of big studies. So there's kind of a question mark as to how effective it is. You hear both sides of it.
Are you asking specifically about hydrochloroquine?
Well, that's one of the questions, yeah. Have you heard anything about the results, where that stands?
Yes, thanks. That's a great question. So we know that the studies that have been done were small. Also, the studies that have been done were, the method, there were some questions about the methodology. And so, on those type of studies, the data, you would, on a normal day, scientists would look at it and say, oh, that's interesting. I wonder if there's something there. We should do a bigger study to really look at this, like a randomized controlled trial. So really what has been published so far is really, not, does not support routine use of hydrochloroquine or chloroquine to treat COVID-19. There really is not enough really robust data to support this use. And I guess it depends who you listen to. I've heard stories from the medical literature and from the FDA with great warnings about this type of medication to use for COVID-19. So I guess, it depends, where you're listening to your news. That we know what we do know about this medication, and that it can have some very serious side effects. We know, especially with the heart, it can cause arrhythmias and some other problems, and we know that young children are very at risk of overdosing from this medication. We say one pill can kill, so this can be very, very toxic medication. So with any medication has good side effects and bad side effects, and you take the medication because you're hoping that the good side effects will give you what you need to be well, and that the bad side effects will be minimal, right? That's why we take every medicine, because every medicine has good side effects and bad side effects. Unfortunately, with the hydrochloroquine to treat COVID-19, the good side effects, the treatment hasn't really been proven. However, the potential toxicity, especially among young children, if they get their hands on it, has been proven. So really, in this case, I think that the risks do not outweigh the potential benefits.
I see. And I guess your personal physician, somebody who's credible, is really the source that you should go to for any individual in their particular case. I guess that's always the best advice.
Right, you're exactly right. I mean, if people have questions about their own personal health, they should talk to their primary care provider. Again, there's a lot of good information out on CDC's website, and there's a lot of good information out on say medical professionals' websites like the American Medical Association or the American Academy of Pediatrics. However, sometimes it can be difficult to interpret it, like how that relays to you, because everybody has their own personal health history and may have issues in their health that might make the information that you read on these websites not really applicable for them. So that's why we have a primary care provider, right? Because they are familiar with our medical history, with our social situation, what we're able to do, if we have access to transport or not, they'll be able to answer our questions about our own personal health. So that's always a
Okay.
great resource.
If you're a member of a household that has an elderly relative or somebody at risk, and they've been kind of locked away for the last month or two literally in fear of their lives, because we've heard so much about how infections can affect these people. It might be a death sentence if this stealth virus is out there and you never know where it's lurking.
Sure. Well, I can say what we know is that we in Erie, at least in Erie County, we are seeing decreasing numbers of reported cases of COVID-19, and we're doing more testing, and the proportion of positive tests have been decreasing. So we've been doing a good job of trying to contain COVID-19 transmission in our community. However, we also know that COVID-19 is still here. And we also know that as stores and businesses start to open up and people start to go out more because of the warm weather, there could be more opportunities for community transmission, and our numbers could go up again. So COVID-19 is here, and it's it hasn't gone away. We've just been effective by social distancing, wearing masks, washing hands. Keeping frequently touched surfaces clean by keeping the transmission suppressed. However, it hasn't gone away. It's still here, and so I think people have to realize that as businesses open up and the weather gets nicer and people want to go out, that COVID-19 is still here. And if we let our guard down, if we stop wearing masks when we go out in public, if we're not careful about washing our hands, if we're not careful about touching surfaces that haven't been washed, then we're going to see our numbers go up again. We'll be in the same place we were before. So COVID-19 is still here, and we still have to take the appropriate safeguards to protect ourselves, our family members, and our community.
We're out of time for this segment of The Big Picture. We'll be right back with more on the medical view of the coronavirus situation in Erie County right after this.